Did you know that doctors can often detect serious health problems just by observing subtle hygiene habits in seniors? What may seem like harmless routines like how often you bathe or brush your teeth could actually be early warning signs of life-threatening conditions. Most seniors have no idea they're making these common mistakes every single day. In this video, you'll discover the 7 personal hygiene errors doctors notice instantly and how fixing them could add years to your life. One man's routine checkup reveals something shocking. Could the same be happening to you without even knowing it? Let's find out. As we begin to uncover the hidden hygiene habits that can reveal dangerous health conditions, we start with one of the most overlooked: oral hygiene. Many seniors assume that brushing once a day or using mouthwash occasionally is enough, but the truth is far more serious. Poor dental care doesn't just lead to bad breath or tooth loss. It's directly linked to heart disease, stroke, and even dementia. Medical research from Harvard has shown that bacteria from gum disease can enter the bloodstream and trigger inflammation in vital organs. Seniors with poor oral hygiene are 3 times more likely to develop cardiovascular problems. These aren't just statistics, they're real stories. Take Sylvia, a 68-year-old retired teacher who ignored her bleeding gums for months. She thought it was just a normal sign of aging. But during a routine physical, her cardiologist discovered inflammation in her heart valves caused by oral bacteria. She was stunned. A few more months of neglect, and the damage could have been permanent. So what can you do? Start by checking your toothbrush. If it's over 3 months old or frayed, replace it preferably with an electric toothbrush, which removes significantly more plaque. Brush for a full 2 minutes, twice daily, and floss every night without exception. Don't skip dental checkups even if you wear dentures. And pay attention to bleeding gums, swelling, or persistent bad breath. These are not normal signs of aging. They are warning signs. You are still watching this video and finding these insights valuable. Please comment below to let me know you are here. And if you are not subscribed, I recommend you subscribe and turn on the bell so you don't miss any of our videos. Your support helps us continue to create good content to inform and inspire you. After understanding how something as simple as gum health can signal hidden heart issues, it's important to realize that your skin, the body's largest organ, can be just as revealing. Yet many seniors reduce bathing frequency as they age, often believing that it prevents dryness or isn't necessary without physical activity. Unfortunately, this habit can conceal serious health problems. Dermatologists at the Mayo Clinic warn that infrequent bathing in seniors can mask early signs of diabetes, liver disease, kidney dysfunction, and even cardiac issues. These conditions often present first through subtle skin changes, dryness, discoloration, or unusual patches long before more obvious symptoms appear. Clarence, a 77-year-old retired postal worker, learned this the hard way. During colder months, he bathed only once a week, thinking it was better for his dry skin. But when his doctor noticed abnormal skin discoloration during a routine visit, further tests revealed early-stage kidney disease. The signs had been there, but the lack of regular bathing delayed detection. To protect yourself, aim for a consistent bathing routine at least 3 times per week, even if you're not very active. Use a gentle, fragrance-free soap and moisturize your skin while it's still slightly damp to lock in hydration. Most importantly, get into the habit of inspecting your skin. Do you notice dry, scaly patches, discoloration, or persistent itching? These may not be simple irritations. They could be your body alerting you to a deeper problem. Caring for your skin is not just about appearance or comfort. It's a daily health check that could catch a condition before it becomes life-threatening. Don't overlook it. Just as the skin reveals hidden signs of internal issues, your fingernails and toenails can quietly expose serious health concerns, yet they're often overlooked. After discussing the importance of regular bathing and skin inspection, it's crucial to turn your attention to a part of the body many seniors neglect: their nails. The condition of your nails acts like a window into your overall health. Doctors and geriatric specialists routinely check for nail changes because they can point to issues such as anemia, thyroid disorders, heart disease, and even immune deficiencies. According to the American Academy of Dermatology, over 30% of seniors diagnosed with nail abnormalities were later found to have undiagnosed systemic illnesses. Take Beatrice, for example. At 82, she noticed her toenails were thickening and turning yellow. Embarrassed, she stopped wearing sandals and hid her feet in closed shoes. "I just thought it was aging," she said. But when she finally sought help due to foot pain, her podiatrist discovered a long-ignored fungal infection. Further tests revealed a severely weakened immune system, which helped doctors diagnose an underlying condition that required urgent treatment. To avoid similar risks, make nail care a consistent part of your hygiene routine. Trim your nails straight across with slightly rounded edges to avoid ingrown nails. Keep them clean and dry, and change socks daily. Avoid covering discolored nails with polish instead. Pay attention to their appearance. Are your nails brittle, unusually thick, or discolored? These aren't just cosmetic issues, they are messages from your body. Taking a few minutes each week to care for your nails may seem small, but it can make a big difference in catching health concerns early when they're most treatable. After learning how your nails can silently reveal deeper health problems, we now turn to a hygiene issue that many seniors struggle with, but few are willing to talk about: incontinence. While nail changes may quietly suggest internal imbalance, incontinence can loudly impact both physical health and emotional well-being when left unaddressed. More than 50% of seniors experience some form of incontinence, yet far too many suffer in silence, using makeshift solutions like paper towels or frequent clothing changes instead of seeking proper care. The result? Skin infections, painful sores, social isolation, and worse, undiagnosed serious medical conditions such as bladder or prostate cancer. Consider Douglas, a 73-year-old retired accountant who noticed occasional leakage but felt too embarrassed to bring it up. He thought he was managing it well until he developed painful sores. When he finally saw his doctor, they discovered an advanced prostate condition that had been silently progressing for months. "My pride nearly cost me my life," Douglas admitted. "Here's what you should do. Never feel ashamed to talk to your doctor about bladder or urinary issues. They deal with this every day. Use absorbent products specifically designed for incontinence, not makeshift materials that can trap bacteria and cause irritation. Change frequently, keep the area clean and dry, and follow up with a proper cleansing routine. Most importantly, recognize that incontinence is not just a normal part of aging. It is often a symptom, a red flag that something else in your body needs medical attention. Whether it's occasional leakage, urgency, or nighttime accidents, don't wait. Speak up, get the help you need, and protect your health before complications arise. Just as ignoring incontinence can quietly lead to infections or uncover deeper medical issues, many seniors make another silent but dangerous mistake: improper ear hygiene. It might seem like a small habit, but the way you clean your ears can directly affect your hearing, balance, and even signal infections that may go unnoticed until it's too late. Many older adults rely on cotton swabs to clean their ears, inserting them into the ear canal out of habit. Unfortunately, this common practice can do more harm than good. Otolaryngologists, ear, nose, and throat specialists, report that nearly 40% of ear injuries in seniors are due to improper cleaning techniques, often resulting in impacted wax, ear canal injuries, and infections, all of which may go unnoticed until significant damage is done. Patricia, a 71-year-old retired librarian, learned this the hard way. She routinely used cotton swabs to keep her ears clean until one day she felt a sharp pain followed by hearing loss. Her doctor diagnosed a punctured eardrum and a severe inner ear infection, which led to permanent hearing damage. "No one ever told me it was dangerous," she said regretfully. To avoid this mistake, follow this simple rule. Never insert anything smaller than your elbow into your ear. Instead, clean only the outer part of the ear using a soft, damp cloth. If you feel buildup or blockage, use doctor-approved ear drops or consult a healthcare professional. Never try to dig it out yourself. Are your ears feeling itchy, blocked, or are you experiencing changes in your hearing? Don't ignore these signs. They may point to underlying conditions or infections that need prompt medical care. Your hearing is precious. Protect it with safe, gentle, and informed hygiene practices. Just as improper ear cleaning can lead to infections and even permanent damage, neglecting your feet can have equally serious and often overlooked consequences. Foot hygiene may seem basic, but in seniors, it's a critical window into circulatory, nerve, and immune health. Unfortunately, many older adults skip thorough foot care, assuming issues like dryness or discomfort are just normal signs of aging. But doctors know better. Geriatric podiatrists routinely inspect seniors' feet for signs of diabetes, neuropathy, vascular disease, and even immune disorders. In fact, studies from the American Podiatric Medical Association show that up to 85% of diabetes-related amputations could have been prevented with regular foot inspection and care. Take Raymond, a 76-year-old retired factory worker. For years, he noticed his feet were dry, cracked, and sometimes numb, but he dismissed it. "I just thought they looked old," he said. But during a checkup, his doctor spotted the issue immediately and ordered tests. The result? Undiagnosed diabetes, caught just in time for lifestyle changes to make a difference. So what should you do? Wash your feet daily, making sure to clean and thoroughly dry between the toes. Moisturize dry areas but not between the toes, where excess moisture can lead to fungal infections. Wear clean, breathable socks and comfortable shoes that support circulation. Most importantly, inspect your feet regularly. Look for cuts that don't heal, changes in color or temperature, persistent swelling, or loss of sensation. These aren't cosmetic issues, they're warning signs your body may be in distress. Are your feet dry and cracked? Have you noticed numbness, tingling, or a sore that won't heal? Don't brush it off. Your feet could be sending you a vital message, one that, if ignored, could lead to life-altering consequences. Take that step toward better foot care today. After understanding how something as seemingly minor as foot dryness can be a warning sign of serious conditions like diabetes, it's time to address a final yet critical mistake: ignoring hygiene-related side effects of medications. Many seniors take multiple prescriptions daily, but few realize that these medications can cause subtle yet important hygiene changes that signal deeper health concerns. Certain medications, especially those for blood pressure, depression, and pain, can lead to dry mouth, changes in body odor, unusual sweating, or even skin rashes. While these may seem like minor inconveniences, they can actually be early signs of medication toxicity or liver and kidney stress. Barbara, a 67-year-old retired nurse, experienced this firsthand. Despite bathing regularly and maintaining her hygiene, her family noticed a strange body odor that didn't go away. At first, they assumed she wasn't showering enough, but her geriatrician quickly recognized it as a sign of toxic buildup from a new medication. Lab tests confirmed that her liver was being overwhelmed just in time to adjust her prescription before lasting damage occurred. What can you do? Keep a journal of hygiene-related changes whenever you start a new medication. Note any shifts in odor, skin condition, or unusual dryness. Stay hydrated and alert to symptoms that feel out of the ordinary. And most importantly, don't dismiss these changes as just part of aging. They might be your body's way of waving a red flag. Always report unusual symptoms to your doctor and never stop or change medications without professional guidance. Hygiene isn't just about how you look or smell, it's also about how your body's reacting internally. Pay attention, speak up, and protect your health by connecting the dots between medication and your body signals. One of the most powerful lessons from this content is that your body is always speaking to you, often in quiet, overlooked ways. For seniors, personal hygiene is not just about cleanliness or routine, it's a direct reflection of internal health. Small changes in your nails, skin, feet, or even how you smell can carry deep messages from within, signaling issues like heart disease, diabetes, kidney failure, or adverse reactions to medication. Too often these signs are ignored, dismissed as just aging or hidden out of embarrassment. But the truth is, paying attention to these subtle cues and speaking up about them can literally save your life. There's dignity and wisdom in listening to your body, in seeking help, and in refusing to stay silent about things that matter. Aging doesn't mean losing control. It means learning to care more deeply, more attentively, and more lovingly for yourself. By being proactive with hygiene, you're not just preserving your appearance, you're protecting your independence, your health, and your future. Don't wait for something to go wrong. Your golden years can be full of life, energy, and joy if you pay attention to what your body is gently trying to tell you today. Thank you for joining us today. We'd love to hear from you. Please share in the comments one insight you gained and how you plan to apply it in your life. Your feedback is invaluable and keeps us motivated. If you found this video helpful, don't forget to like, subscribe, and share. Your support enables us to continue creating content that informs and inspires. Thank you for watching, and we look forward to seeing you in the next video.